Welcome to the Rescue SF Speaker Series. My name is Sean Carlin. I'm with the India Basin Neighborhood Association. Today we've invited Louis Chicoine, the CEO of Abode Services, to tell us a little bit about building and operating supportive housing. Rescue SF began in response to community frustration with the seeming rise in homelessness on the streets of San Francisco. Our mission is to create a clean and safe city for all San Franciscans. Rescue SF has two main objectives. First, to educate ourselves and others about the homelessness situation in San Francisco. And second, to build a citywide coalition that will advocate with a united voice for effective solutions from City Hall, Sacramento, and Washington. As part of our journey, we're producing this series called Rescue SF Speakers, where we hear from all stakeholders who have been involved in the homelessness crisis to help develop a framework for effective common sense solutions that provide transparency and accountability to the public. Rescue SF is hosting this series and providing these videos as a public service on the website. The views expressed by guests are their own, and their appearance on Rescue SF Speakers does not imply an endorsement of them or the entity they represent. Today's host is Mark, one of the founders of Rescue SF. We'll structure this talk with the first 40 minutes dedicated to a conversation between Louis and Mark. During the remainder of this event, we'll ask Louis to respond to some of the questions from our audience. That you can submit your questions in the Zoom Q&A at the bottom of your screen. With that, let me welcome our host, Mark Nagel. Mark?
Thank you, Sean. I'm Mark Nagel. I've been part of Rescue SF since it started in February of this year. Today, we are delighted to have with us Louis Chicoine, the CEO of Abode Services, which is the largest homeless housing and services provider in the Bay Area. As Abode Services leader for 25 years, Louis has helped the organization become the leading provider of housing and services to residents experiencing homelessness in Alameda, Santa Clara, San Mateo, Santa Cruz, and Napa counties. During his tenure, Abode Services has grown from a local startup with one shelter serving 66 adults and children into a regional organization that owns and operates hundreds of supporting housing units and provides services to more than 9,100 adults and children each year. Welcome, Louis Chicoine. Thank you for joining us today.
Thank you, Mark. Good to be with you.
Great. Well, look, let's start with some about your personal background. How did you decide to devote your career to addressing the crises of homelessness and housing?
I think it started in high school when a teacher gave me the book Search for Meaning by Viktor Frankl. And it became clear to me at that young age that I wanted to do work that had real meaning. Didn't know what it was going to be yet, but I knew that much, and that led me to work that involved improving communities. That's always how I've seen this work. It's about making individuals healthy so that communities are healthier. And worked at church for a while and then went and got a master's in social work. So I got the training necessary to put the ideas together and a focus in administration. I enjoy this work for the most part. I spent a lot of time trying to convince government and other partners to move along with us. We have made mistakes, so it is also interesting to be in the sort of work where you can make a mistake and then improve over time. So I enjoy that part of what we do as well.
Great. Let's talk about your work with Abode. When you started at Abode, Abode was a shelter provider.
Correct.
For people who have not been to a shelter, what actually is a temporary homeless shelter? What does it look like? And what's it like to live there for the people that are occupying the shelter?
Yeah, shelters come in a lot of different shapes, but generally they're always congregate living. So there are a lot of people living in one building, and it's an attempt to get a lot of homeless people off the street, as many as possible. So the shelter we ran, though, was actually, and still run, is a shelter that was built to be a homeless shelter. So it's a little unique because most shelters are in renovated spaces, thus making it a pretty challenging place to live because people are very close to you. People are having troubles. They're in crisis, various levels of crisis. They're having to share the same space with other people in crisis. So generally, it can be a very challenging place to live For operators of shelters, it's really necessary to have very clear and firm rules and policies so the place is safe and dignified for the people living there. Rules equal taking away of freedoms. And so that's the balance of a shelter environment. And sort of led us to the realization, I mean, the numbers around the success coming out of a shelter are pretty low. So a shelter is really about keeping people safe and secure night by night.
At the end of the dot-com boom, Abode Services made the decision to move away from being a shelter provider to adopt housing as a solution. And that's the policy called Housing First. What is Housing First? What does a Housing First solution look like?
Well, it's probably easiest to start from what it isn't. So what we were doing previously and what a lot of providers do is a service focus. So basically the concept is homeless people have problems. You provide something in the way of life skills to individuals and they'll get better and they'll get back into housing. The reality is that methodology doesn't work very well. Housing First actually presents a different approach. It says human beings need housing. They don't have it. You got to do everything everything possible to get them back in housing and focus on that first and then wrap around the services necessary to keep them successfully in that housing. And in doing that, the data is pretty clear that the success rates are 85% plus, that individuals will get into housing and maintain their housing, keep the housing for a long period of time.
Okay. Last week, we had on this speaker series Emily Cohen from San Francisco's Department of Homelessness and Supportive Housing. And we talked about the importance of addressing homelessness from two directions. We have to end the homelessness of the people who are currently on the streets and find a path to sustainable and permanent housing for them. We also have to prevent people from falling into homelessness in the future. Abode Services is interesting because you have a wide range of activities within Abode that are both, some are addressing ending the homelessness of people that are already homeless and also preventing future homelessness. Can you describe all the different activities that you do and how they either end homelessness or prevent future homelessness?
Yeah, so I'll put them in big buckets. The front door sort of services are really involve outreach to people who are living on the street. And the methodology we use is a peer leadership clinical partner approach where we have a clinician with someone who's experienced homelessness going out and being with and engaging with people who are living on the street. We also have health care services that often accompany those services on the street, because obviously healthcare is a large presenting issue to those who don't have shelter. So that's sort of the front door to how, you know, we develop a relationship, a trust. Hopefully we are able to get folks right off the street into housing of some sort, or at least a shelter environment where they can stabilize and improve their health and then move into housing. The other piece that we do, obviously, the center of everything we do now is housing. And that comes in three main buckets. The first relates to what's called rental assistance, where we buy down the rent for people to a level they can afford. And if you can imagine the most chronic homeless person who can't work, their income may be SSI, which is a little over $800 a month. So they can pay in rent about $200, $300 a month. We're making up the difference through rental assistance. We're getting that rental assistance dollar from government agencies that we partner with, and we're placing people into the marketplace. So regular apartments where the person can either be in a tenant-based lease or where they're on the lease, or if they're really chronic, where it's a master lease where we're actually there in between the landlord and the tenant. And that's a strategy to keep people in housing so that if there are issues, we're on the hook for really addressing them directly with the individual. The other way we're creating housing opportunity is through development, actually, of permanent supportive housing. We have 15 buildings we're working on right now in the pipeline. And so we're at a rate of development that puts us up there with a lot of the larger nonprofit housing developers. Our product is permanent supportive housing, though we don't always do 100% chronic homeless. We like to have a mix in our population so that people feel like they have a community that represents the community they step out into during the day. That is a mix of people, some working, some maybe disabled and not working, families, individuals. We just find it better to have a representation that is much more representative of what you would find in your town just generally. And then finally, everything we do has services with it. So Housing First is not a denial of the importance of services. It's a refocusing the services on getting people into housing and keeping them in that housing. So the services we have are very individualized. We have folks who have, as you can imagine, severe mental health issues. So we have clinicians that are working directly with those individuals. We have other folks who, it's very light touch services, helping them connect with childcare. Maybe it's helping them through a reemployment process, training and placement into a job. And those folks, basically are going to be on their own at some point. So there's a transition off of a relationship with us, basically. They actually are going to take over the lease, and they're going to not need our services on an ongoing basis. What's interesting is that it's about 15% of the population is chronically homeless, disabled. Though when you think about the information you get about homelessness, that number seems so much larger, right? The largest portion of homelessness is actually family homelessness and homelessness that's episodic. People going through an economic downturn. We're going to see a bump right now because of evictions and massive unemployment. But it's the category, and the good news is the category of folks who have less needs and who can do well with lighter touch and services and lighter assistance on the rental assistance side.
Let's talk a little bit about permanent supportive housing, because it gets a lot of attention. It's a big part of what you do. It's also that happens to be the most expensive type of housing to develop because there are a lot of specific requirements for it. And you mentioned it's for the chronically homeless. Can you just explain for people, what does that mean as a term of art? Who are the chronically homeless? Who are eligible to get into this permanent supportive housing?
Yeah, so there's a HUD definition of chronic homelessness. I won't take you through that. I just described it. It's long-term periods of homelessness. And more importantly, it's really about disability. So they either have a very significant mental health or physical disability. Along with that, there's often issues with substance use that comes with the disability. San Francisco, don't need to say much to folks who live in San Francisco because there's a higher concentration of this chronic homeless population. This 15% I was giving, I think it's a much higher number in San Francisco. And so you see it right in your day-to-day lives. Your mission is really focused on the quality of life issues that are resulting from this segment of the population not being served. And I'll say real quickly that, just make an upstream comment, that the reason people end up in homelessness in this category of chronic disabled is primarily about lack of discharge planning. So these are individuals who more than likely were in some system that was adequately or inadequately taking care of them, but it was a system. It could be the military. We have a lot of veterans in this category. It could be mental health facilities. It could be jail at some point. It could be a foster care. These are all major systems with a lot of resources. And they were discharged at some point from one of these systems, and nothing replaced the services that they were receiving. Or that's an exaggeration. They're obviously still receiving services, but generally on an emergency reactive basis. Law enforcement, ER rooms, emergency psychological services, the most costly services in any county or city. And they're finding their way to those services because they weren't discharged appropriately into. So permanent supportive housing really is the discharge. There's a doctor in Honolulu, Hawaii, who actually writes homeless people in this category a prescription for housing, and says, take this to the county because this is what they should be giving you and you'll be better. It's sort of tongue in cheek, but it actually, that actually represents the reality. And I'd like to make one last point about permanent supportive housing. It is costly, but it is not necessarily more costly than doing nothing, because those emergency services, the County of Santa Clara did a cost study, and they found that their top percentile chronic homeless folks cost the county on average $84,000 a year in emergency services. And that wasn't even a comprehensive study of city services. That was just county services. So if you think of $84,000, in that county right now, we're housing that same population for around $34,000, which includes wraparound clinical services. Half the cost to do nothing, and their lives get much better, and the impact on neighborhoods is significant as well.
Abode is very interesting because you both build permanent supportive housing, and you also have a whole team, a part of your organization that provides the services. So let's talk about each one briefly, separately. As a builder of supportive housing, what does a development of supportive housing look like compared to a typical development? Is it, would you notice anything different? Are there certain requirements about it? Is the building of supportive housing more expensive than the building of a typical housing project?
It's a little bit more expensive just from the get-go, because the design of the building, to answer your question about is any different, the apartment units will look much like any apartment unit that any of us would rent. But the other space, there's other more common spaces that'll probably be larger in order to encourage communal space, space for people to interact, different spaces so that people can interact in a healthy way. And then there's also office space for clinical staff and property management staff, which tends to be an element that you won't find in a market rate unit, for example. So they're different. So those are there's some cost differential related to those. The biggest cost differential on permanent supportive housing, quite frankly, is that we haven't figured out how to build permanent supportive housing in the marketplace. It relies on almost 100% public funding, government funding. It's because if you have $300 in rent to pay, you're going to need to somehow build the space, not based on an assumption of rent paying for a mortgage, for equity in the building. So and government, quite frankly, has not figured out how to be super cost effective in the way it has processes and the way it allocates dollars.
And as a provider of those supportive services, what does that look like? So when you have someone, formerly chronically homeless, that's now living in the building, and you have the wraparound services, what are all those services, and how do you provide those services to the people in the building?
Yeah, I mean, I'll start by saying that actually the building of the building and the services go hand in hand. So our service staff is actually involved in with the architects on the planning of the space. So it's they are very different activities, but we integrate them because we know the service staff has to, and the people living there have to live with the space afterwards. The services are really sort of three circles. The first is about the individual who's going to live there and their goals for their life. And just because they get into housing, it doesn't all end. There's challenges. The first set of challenges is going to relate to getting to the services they need. Do they have access to a local doctor? Do they have access to mental health services they need? If they're a parent, do they have access to childcare? Do they have access to the representatives at the local school district who are there to help homeless families transition into the neighborhood where the school is? So that would be the first circle, is the individual. The second one is the building itself. And we spend a lot of time trying to create a sense of community and cooperation amongst the tenants, some ownership, if you will, of the building and of the community. And that involves everything from having parties together to making sure everyone is recognized on their birthday in a special way, that there's a sense, a spirit, a culture where if someone's in trouble, that there's a process for letting someone know about that or getting involved directly yourself, maybe to help them. The final circle is the broader community. It's the neighborhoods. This is primarily Rescue SF's focus, right? So we don't build buildings and try to remove ourselves from the community. We do the opposite. We try to encourage everyone from our staff to our participants to be involved in the community, in that final circle. And that very tangibly might be involved, volunteerism within local nonprofits or city activities that are available to residents. Maybe something like CERT, which is an emergency response team. We've had individuals join that and be part of that. Our theory and practice seems to bear it out, is that if we can get people engaged at that level, they're going to have more ownership in their community. Their lives are going to be enriched. And obviously the community is ultimately healthier for it as well.
I'd like to get your opinion about the situation right now in San Francisco. So San Francisco also is a housing first advocate. They have housing first here as a policy around the city, that the solution for homelessness should be housing and not temporary shelter, although there's of course some temporary shelter here. The problem, of course, is that there isn't enough permanent housing for people in the city, whether it's just regular affordable housing or permanent supportive housing that you just discussed. So as a result, we have waiting lines of the homeless on the streets of the city. And that's why we have the crisis we're in right now. It seems on the one hand that there might be an obvious answer, which is to have some kind of temporary shelter. If there isn't enough permanent housing and we don't want people sleeping on the streets, then we need to have temporary shelter somewhere that's sustainable and long-term until more permanent housing can get constructed. However, if we remember what you talked about at the beginning about shelter space, shelters have been criticized for being unsafe, unhealthy, dirty, and sometimes just a nasty place to be. So not very palatable. So what is a potential answer for San Francisco? Because having a waiting line of the homeless on the streets is not a good solution.
Yeah, and so this is a controversial position, maybe in other communities, but I've said this to you before, Mark. I mean, basically, I think San Francisco is unique in that there is some resources in the city that does attract some people to the city. And I think, quite frankly, San Francisco is part of a much wider regional microcosm. And we need regional approaches to this to help spaces like San Francisco, because the cost of housing is so costly. The cost of doing a building, a shelter building, is a lot more in San Francisco. So I do think there needs to be collaboration across the region to address homelessness, as opposed to just each region like San Francisco trying to figure that out themselves. Not from the basis of an excuse for not dealing with the issue, but from a realization that we ought to do whatever we can to find vacant available space to put people in. So I'll say that first. I've also shared with you, Mark, that I have a bit of dichotomy in me about shelter because we're real advocates for housing. We know that actually works. Shelter works like an ER room in a hospital. It keeps people alive and it stabilizes them, makes it easier for them to move into housing. So I do agree with the premise that we have to find some more shelter space, more hotel space. This is something we're doing right now. We're operating 1,000 rooms, hotel rooms in the Bay Area. It's basically around, largely around COVID, vulnerable people, or in some cases even positive folks. It's making the community safer and making homeless people safer. But that's a really good model, an alternative to shelter, because they get their own room. Whereas in most homeless shelters, you're in a bunk bed next to someone else who's in as much crisis as you are, and the math just isn't very good in my experience. So I think there are ways for us to be very creative about developing space that's temporary, or the term that I often hear is interim, so that you're moving people into safety while they're preparing to move into more permanent housing. But it's not a long-term solution for them. If you look at it that way, it actually becomes more bearable for the person going through that experience if they know they're going to get their basic human need for housing met later. And I think it's easier to manage. So I think we're in a space where we can invest a little bit more and get spaces that have more private. San Francisco had to clear out shelters during COVID because they're just so congregate. People are just on top of each other. I think if there were separate rooms, for example, and you can do very small rooms, SRO type rooms, that the city probably could have, probably would have avoided this sort of challenges it had around having to relocate people out of congregate living. So to answer your question, I think right now I'm pretty convinced that we need an interim plan, interim housing, as we prepare and build the permanent supportive housing around the Bay Area. We need to be open to buying buildings that exist and rehabbing them to use them. We can't be purists about this because the answers are going to, probably be 20 different approaches versus 2 or 3.
You mentioned the possibility of looking into regional solutions for homelessness. There are other people like yourself who have mentioned that. San Francisco is in dialogue with other governments around the Bay Area, but there are not right now detailed discussions about sort of regional cooperation on finding housing for the homeless. So San Francisco is land poor, but has a large homeless population.
Right.
The challenge seems to be, how do you, and maybe if you thought about this, how would you actually negotiate the nuts and bolts of moving San Francisco's homeless population to another city that has more land? Why would that city build a lot more housing specifically for the homeless?
Yeah, they won't. I mean, this is where I'm going to be very controversial and blunt. I think it needs to start with coercion, and it started already with David Chu, for example, had a bill that now allows us to build permanent supportive housing projects on land that's zoned appropriately, where we don't have to go through the environmental review. We don't have to go through the approval process in suburban cities that we normally have to go through. And it's transforming the speed at which we can do projects. And actually, in many cases, it's actually making projects that were not politically feasible, now feasible. So I do think we need to get out of what is clearly, to me, a racist land use process in the state of California, run by people who got there first, who say, no, you're going to ruin my neighborhood by building this project. And, quite frankly, we build these projects, and I can assure you that 9 times out of 10, they're the best looking building on the street, because they're the newest, and because of the government funding, they have to have the highest standards about them. We want the highest, we want them to be attractive, well-run buildings, so we run them well. There's absolutely nothing to this concept that is going to destroy a neighborhood. So I do think we have to take away this false democracy that we've given suburbs to basically discriminate, to exclude certain populations from their neighborhoods. We're starting to do that already with legislation at the state level. We need to go a little further, and then basically that negotiation, that regional conversation, I think will begin to really take foot. The other piece of it is, the city has to probably provide things like funding. If maybe they're going to share their pool of funds, because San Francisco, quite frankly, most cities don't have HECI or Measure C. Again, I said I was going to be controversial. I think, the city would probably have to be open to regionalizing funding for various projects. If we took a fair share approach on this, the suburbs are nowhere near where they need to be in terms of developing housing options. And I think it's really clear that we can't do it all in urban centers like Oakland and San Francisco.
San Francisco is a challenging place to find land for new construction, especially for affordable construction, given the high cost here. But San Francisco does have, obviously, a lot of existing buildings. And so there's a debate about the usefulness of using new construction versus renovations of existing structures. How realistic is it for San Francisco to employ renovation as a strategy for converting a lot of structures to affordable housing?
So I'll tell you the challenges first. If a building isn't built to be permanent supportive housing, then, if you think about my description of the space we need and so forth, then we're going to have that challenge right up front. That can be worked around with good architecture, architectural design, but it's still a very significant challenge, particularly if the property you're rehabbing isn't scaled. So if it's too small, then you're really limited, right, in creating community space and open space and office space for the operations of the building. So that would be the first challenge. But again, I think in a place like San Francisco, this is one of those 1 in 20 options for really getting at use. There are different ways, and the city's doing this. I should say, you have great staff in the county and the city of San Francisco working on some very creative answers right now. One of the answers is to do a master lease approach. Go to properties that don't necessarily need to change ownership, lease it in a master lease approach, the whole building, and then convert it to the sort of use that you intend, with a quality space for the people living there and for the staff that are going to work there. I think it's a real option.
A lot of your activities, all of them, involve working with government. So a lot of times government can be helpful and sometimes not. So in your experience, and what are the ways that government can help support your work, and what are the types of behaviors you see that get in the way of both pushing housing for the homeless, but also just affordable housing in general?
Yeah, I think of all the extremely positive relationships we have with individuals in government. It's often really about individuals, and if their heart is in the right place and they have some desire to take a little risk, because when you're in government, everyone's shooting at you. And so you have to be willing to take a little bit of risk. If something goes wrong, for example, if you're the government official, you're often going to be called on the carpet. So I think of all those courageous people we work with across the 7 counties we're in now. And if we could give people, more government folks, more cover So for example, that legislation I was referring to before around land use, I think that is a model for basically just saying, this is going to happen within these standards. So it's not a, neighborhoods get dumped on, but neighborhoods don't get to say no to things just because they don't want them. They do have a right to insist on high standards, but outside of that, they can't say, you're not, you're going to take away some of the NIMBY rights, if you will. Again, this is all editorial. And if you set up that environment, you would create some backup for officials to take more risk in the creation of units. I think the standard side of that's really important and not that hard to do. Basically, you take the current code and standard for building and you say you have to reach that at least. And with permanent supportive housing projects, you need these 10 elements. And it's going to have to do with community space, security on the site. We do single entry into all our buildings so that basically if you go out the back door, which is a fire door, an alarm's going to go off. There's going to be cameras around the building. It's not because we don't trust the people we work with. It's because we often have, because people are humans and because we're going to assure the people that live there in that building and the rest of the community that they're going to be safe, then we really have to have procedures, policies, and mechanisms for ensuring that that actually happens. But anyway, back to the question, I think if we allowed government more latitude to get it done, there is way too much process and conversation about solving this issue. I've seen it in my lifetime. I've grown up in the Bay Area. I've seen it in San Francisco. You could just name each mayor that San Francisco's had and the position they took. Sometimes it was to be the hard ass. Other times it was going to be the compassionate person. I think of Art Agnos. I think of the former chief of police who was. So creating an environment where the expectation is that government deliver on this, that this is not acceptable to fail on this, would I think actually provide some backing to the employees who have to make it happen.
Before turning over to Sean to get some questions from our audience, I'd like to ask one final question. In the last 6 months, we've transitioned into a new world. We're now living in the pandemic, in an economic crisis. What does this new world mean for the future of homelessness and housing?
Yeah, so the one reflection that I have is it's congregate living environments need to be rethought. And I think that can be solved with good design. I mean, the great thing about the Bay Area is we're just full of really talented people. So that's one piece and we're actually having solved that in our office spaces as well. And we're developing a pretty comprehensive telecommuting policy like every other company in the Bay Area. So that's one impact. I do think the whole issue of the intersection between healthcare and homelessness has really been, there's really a spotlight on it now. Clearly, this is a life and death venture that we're in. People will die if we don't get this right. And permanent supportive housing, as the good doctor in Honolulu knows, is about healthcare, but also the healthcare system. I sit on the public hospital board in Alameda County, and there's a total disconnect between the worlds. And homelessness costs public health systems incredible amounts of dollars because almost people end up sitting in hospital beds because they can't discharge them back onto the street legally, which is a good thing, but it's extremely costly to the healthcare system. So I think COVID has actually really presented an opportunity, a real clarity around the need to have healthcare and housing integrated with each other and people working together more effectively.
Great. Well, let's now take some questions from our audience and we'll turn it over to Sean.
Hey, Thank you. So yeah, the very first question we got right off the bat was a question about housing first. It seems like that was a mistake that was made in the 60s, our commenter writes. Lots of housing was built, but the support wraparound was never followed through. How do we see that happening today? What's going to make it any different now?
Yeah, so the question is probably referring to a large amount of public housing that was created that didn't come with adequate services. Yeah, I think that's why it's really important to qualify housing first with it's housing first, but not only. That part of the housing equation is really successful services. I make one other point to the questioners to the point the questioner is making, and that is, during the Nixon administration, it was commonplace. I believe there was actually a statute, internal statute, that required the development of public housing to be substandard to the local standard. So, and there's actually a very fascinating study. I lost track of where to find it, but so you'll have to take my word on this. That the housing projects that really failed in the 60s and 70s failed in correlation to how much greenery they had on site. And which is a really interesting way to indicate were these places for people, or were they just concrete, village, jungles for folks. So it's also about the space. It's so housing just for the sake of housing, to the point, can't be the approach. It has to be quality housing along with services.
That's really interesting, actually. That's an incredible correlation, maybe causation. But as long as we're on the subject of history, back in the Depression, 1935, there was a book written by Catherine Bauer called Modern Housing, which essentially talked about housing as a right for people. And they were, of course, dealing with the Depression at the time. But in many ways, we have, some similarities to that time period with our pandemic going on. Do you see do you see housing as a right, and how could we, and if it was a right, how can we as a community, as a society, ensure that everybody had access to that right?
Yeah, it's a great question. I have no doubt in my mind that it is a right, because it's a basic need. I think basic needs have to be viewed by healthy societies as rights, because when you don't make them a right, then you have incredible suffering and incredible cost to the full community. So absolutely. And I think the other thing I would say related to that question is just look at fair housing. Just look at land use policy in the state of California. And I've already alluded to this in the suburbs. I never imagined myself moving back to the suburbs, but I had a family. That's where my job was. I ended up living there. But I have this so I'm much more of an urban soul. And one of the reasons I'm an urban soul is that basically suburbs are exclusionary. They're about excluding people. And land use is the way. So I'd encourage people to look at some of the literature around how we've enforced racist policy through exclusionary housing policy, and that's true. And homeless people are right in the middle of all that.
I'm looking at a question here about. So you mentioned this earlier when you were talking about some of the publicly owned lands and some of the publicly owned spaces. There was a question about converting derelict buildings in San Francisco, maybe old office spaces, into housing. How does that jive with the work you're doing?
Yeah, I think it all is possible if the government gets out of its way. So again, one of the creative things that San Francisco is doing is they've created an authority that is going to do these master leases. So it's not the government taking its buildings and trying to control how their new use goes, but they're actually putting it into a nonprofit LP sort of structure so that creativity can happen with the use. But if you go down the hallway in San Francisco to the planning department, wherever that sits, I'm not sure if that's with the county or the city, but wherever that sits, if those folks say no, things don't happen. So you really have to have integration across the board. But the bottom line is it's all possible.
And what would be some of the tactical steps to sort of help the government make that decision?
I think I don't know the answer for San Francisco, but I know statewide the answer has to be at the state level. There has to be a loosening of the authority that local jurisdictions have to say no to creative ideas. Again, have to have a set of standards so that we're not building stuff that literally stinks and looks ugly and is poorly operated. But once you've met that threshold in the regulations, people ought to be able to do creative things that look good. And so the state should, most of the authority there is with states. It may be a little different in a county-city arrangement, like the city. That's why I'm hesitating a little bit to say how it should happen in San Francisco.
Do you have an example of a well-kept, well-maintained, federally funded housing project in San Francisco?
You know, I'm a little less familiar with the city. I know there are a lot of buildings run by an organization called Mercy Housing. And I was in one of their buildings. We're a service provider to them. So we have our own buildings and then we provide services to other nonprofit organizations. Beautiful building. I'd love to live there. The space, and it's down, I think it was down in the financial, not far from the financial district off of Market. Just tucked in. It was an infill project, one of those things where you really need an architect because they were butting right up to another use. But just a beautiful space. It had a beautiful garden space in the center, very calming. I wanted to stay there for lunch. It was that sort of space. No, those buildings exist throughout the city. Actually, I saw 2 or 3 of those buildings by Mercy, but there are other developers as well.
And I guess one of the follow-ups I have here from Anna is, what about the ability to maintain and sort of keep the maintenance up on these spaces? I mean, we hear stories of, mold and broken windows, broken elements of the structure, or even smoke detectors that don't work and possibly causing people's death. I mean, what's the standard around that? And is there a good standard?
Oh yeah, and they're pretty black and white standards. And so basically when you're in that situation, you have 1 or 2 things happening. You have a nonprofit who doesn't have enough resources to operate the building, or a private owner who is basically a slumlord, skimming off the profits and not putting it back into the building. The other thing you might have is, this is true. We have a couple buildings like this that we inherited from other organizations that don't have adequate financing, funding on the project. So that decision was made 20 years ago, and now we're still living with it. So we have to actually bring other dollars in from the organization, fundraising and so forth, to make up the difference. There's only so much of that you can do. So what's really important, and this is where we become warriors, quite frankly, is that we will not build buildings unless they have an operating budget that's adequate. Now, the good news is that funders are usually aligned with that. They don't want you to operate a building you can't operate. And so back to the Mercy housing example, those are buildings with very appropriate, healthy operating budgets, and you go into them and you can tell. The examples you're giving are either, they were underfunded initially, or they're run by someone who doesn't care.
Yeah, and of course, you're going to see a bit of that. Can you describe a little bit in more detail the interaction your residents have with supportive services? Like, when they show up, do they get a caseworker, or, how do you track progress? And then I guess I would add to that, what does a successful outcome look like to you?
Yeah, that's interesting. Okay, so the relationship with a resident who's going to live in a building starts actually at the point of lease up, which is usually 6 months before the building is open for people to live in. And so we hire staff early, 6 months early, and we start working. Those individuals get assigned a service coordinator. We refer to our staff as service coordinators, not case managers, because we want to take the power language out of it. And the whole idea is in a deep development of a relationship that is really a partnership. And we use partnership language as much as we can. So on the front end, it's often about, do they have a driver's license? Do they have the birth certificate, all the records you need to qualify with the government qualifications for an affordable housing unit. But once they move into a building, it's the real primary objective is quite simply that the people are thriving, they're happy, they're integrated into the community, and the big metric is, are they sustaining their housing? Are they keeping that housing? And I can say much more about that, but that is not as easy as it sounds. We do have a very high success rate. When you do give someone something of quality and meaning, it's easier to have them keep that. So it starts with the building itself, and then the services is sort of the frosting on top of the cake to help people feel like they're not alone and they're supported in the moments where they go into crisis, if they do.
Yeah, and this is a little away from maybe your area of expertise, but maybe not. The question Abigail has here is, what about housing near public transportation? How much do you value that, and is that a consideration when you're putting your plans together?
Probably less. We care a little less about that than a affordable housing developer who's working with low-income people who are primarily working. But I would say we care because we actually generally find that work is really, it's another basic need for a lot of folks, assuming they can work. So being in the Bay Area near transportation just opens up much more possibility in terms of jobs if you're low income. So while it's not a deal breaker for us, we do we do prefer to find something that has transportation links.
And then there was a question here about demographics. I don't know if it's completely relevant or not, but do you have some kind of demographics that you're looking at when you're putting your statistics together?
So I'm not sure what the question is getting at. So let me try to answer it this way.
Okay.
Is there a clarification?
I'm just looking to see if there was a clarification. You know what?
Try to answer it. If I didn't, then maybe I can come back to it.
Okay. Yeah.
So basically, most of our programs now actually receive people through systems that are called coordinated care. And basically, wherever a homeless person hits a service, they are put into this coordinated care system and then referred to upstream providers like Abode to be housed or sheltered, or to receive outreach. And that is transfer, so it's not a first come, first serve anymore. It's much more about a prioritization of those who need the service the most. And so our demographics represent, a high vulnerability rate. Now, I'll say real quickly, a very interesting conversation is happening right now, and more than interesting, very important conversation about racial equity. and making sure that people of color who are disproportionately represented in the homeless population have a representation of access to services that's equal, at least equal to their representation in the homeless population. And there are some disparities. And, you know, it's not completely clear why there are. It may be some implicit bias at some point in the way people are receiving services on the front end. So there's a lot of talk now and planning around adjusting acceptance of folks into services. I don't know if I got to what the question was asking.
You know, the question was up, and then I went to look for clarification, and it was gone. So,
okay. Well, maybe I helped. Maybe I didn't.
Or maybe they got their answer earlier. Okay. There is an interesting question about how you deal with people who might be problematic in your services. Mm-hmm. Do you have a structure for helping people who are possibly in extreme crisis or not, or even just not following the rules in a way that's useful to the whole community?
So this is really a nut of what we do. So it's about the relationship we have with people. So we work really hard on creating trust. And it's so much easier. And this is why I think law enforcement's in such trouble right now. They don't have relationships of trust in communities anymore. They have relationships of force. So for us, we're in a place where we're generally in a pretty good relationship with the people we're serving. And so if someone's in crisis and someone's having trouble following rules or getting along with someone else, we are engaging in mediation. We're engaging in reduction of harm. So often, you know, substance use can be in the middle of someone's behavior troubles or someone's mental health related behaviors. And so we're engaging in what can we do to help you be successful in this? It's like having your own personal coach. That's how we like to frame it with our staff. We are there as a resource to folks. Some people don't take the resource but that's very limited, and it's very sad when it happens, because generally that means that someone's going to have to leave an environment where they're potentially not going to be offering safety to other people, including our staff members. Pretty rare, but we're also very firm on that side too. Right.
So we've got only 1 minute left on our timer here, and just a quick, how often do the folks who move out again into permanent housing? What's your kind of like success rate?
Yeah, so it's interesting. This is a metric we're measuring everywhere, and so the chronic homeless population, once they get housing, stay in that housing at around a 92-93% rate year over year. So, and that's our highest success rate. It probably because those people have the most to lose if they lose their housing, right? They have motivation. The next group, the episodic group, where we use more temporary housing assistance, they maintain their housing around an 84-85% rate. And it's understandable, right? Because if they're on their own again with rent, they're often low-skilled workers, then they're very susceptible to losing their housing again. But you know, the good news is 84-85% success rate for at least a year. And then we track now multiple years. The rates go up. They actually get better the longer people are in their own housing.
Oh, that's good. So I'm going to hand this back to Mark now, because we are at 1 o'clock, and I want to
Sean,
everybody is respected. Thank you so much.
Louis, thank you so much for joining us today. We're looking for the best ways to address the homelessness crisis here in San Francisco, and you gave us an inside look at the construction and operation of housing for the chronically homeless. It was very insightful. Thank you so much. Abode Services also, of course, provides refuge for thousands of people every year, which is amazing work. So thank you for your dedication. Wish you the best.
Thank you, Mark. Appreciate it.
I'd also like to thank our audience for joining us today. we have an upcoming speaker announced. After today's talk, we're going to take a break in our speaker series in August, and we'll meet again on September 9th. We'll have Jennifer Loving, the CEO of Destination Home, a public-private partnership serving as the backbone organization for collective impact strategies and homelessness in Santa Clara County.
He's much more interesting than me, Mark.
Yes, exactly.
I would highly encourage people to attend that one.
Lewis is on the board of Destination Home.
Yep.
We've been searching for best practices that might have lessons for San Francisco. This is one. So tune in to learn more. We look forward to seeing you all in September. Thank you, everybody.